I'm going to present now Unipisa, represented here by Francesca Pecori from the Department of Political Science of the University of Pisa and a researcher at the Committee for Equal Opportunities at the same university. Her work has been assisted by Rita Banchieri, Associate Professor, and Vanessa Manzetti, Senior Researcher in Public Law, both from the Department of Political Science of the University of Pisa. Francesca, the floor is yours.
Good morning. Can you see the presentation?
Yes.
Okay. So, research and analysis conducted by the University of Pisa work unit focused on the relation between gender and medicine by considering the importance of a gender perspective in medical practice to promote a health system that take into proper account the sex and gender differences. Research and analysis conducted by the University of Pisa. Sorry, but I don't hear you. Can you hear me?
Yes, yes.
Yeah.
Continue.
Okay, by considering the importance of a gender perspective in medical practice to promote a health system that take into proper account the sex and gender differences. The president of the Istituto Superiore di Sanità, Silvio Brusaferro, indeed underlines that it is fundamental to direct future orientation and scientific research towards such a perspective. Accordingly, the Italian Ministry for Health, Roberto Speranza, put at the core of the debate the very necessity of making investments in strategic and structural manners to relaunch and reform the national health system. And here stands the invitation to adopting the gender perspective. The University of Pisa work unit has been operating in the academic context by aiming to a plurality of different subjects, especially professors, specialists in the medical field and those who work in the health system in general, and students. The major objective is to identify good practices and elements favoring the formulation of policy guidelines. To that end, it was realized a multi-level study. Firstly, it was prepared a mapping and update analysis of the institutional actions aimed at promoting the development of gender medicine at international and European level to pinpoint the different approaches adopted from a comparative perspective. Secondly, a focus was devoted to the Italian context, especially to the current framework of Italian legislation on gender medicine. Thirdly, it was conducted a quality investigation by providing partly structured questionnaires to the students of the medicine department who attended the course Gender and Health by Professor Rita Biancheri to collect and analyze evaluations, opinions, and suggestions concerning this approach in order to favor its dissemination at both theoretical and practical level. Formation plays a key role beginning from the early stages of the medical career to promote and support the gender perspective in healthcare. The time frame to fill out the questionnaire was 1 semester. The number of the respondents were 80 students from the Department of Medicine of the University of Pisa, as I already said. The gender of the respondents was 60% of women and 40% of men, and the average age is 25 years old. Here I present some of the results of the quality investigation. First, the proposal of adding the gender perspective transversally to all subject matters of the medicine degree courses. The perception of scarce publicity of issues concerning gender medicine on their frequent banalization when they're addressed. The widespread reference to stereotypes which do not allow the proper recognition of gender medicine. The latter is also damaged by conservative and old-fashioned views of medical methods and by a good deal of skepticism among patients, by contrast to the so-called sex and gender innovation. It was detected a certain difficulty in the actual personalization of healthcare, which can be qualified as lacking a scientific and objective character. It is necessary to have awareness activities by the media and an improvement of communication systems to strengthen a culture that gives value to differences. It was put stress on a series of specific issues related to the practical application of gender medicine and to the risks of extending the duration of diagnosis and care, as well as the increase in costs for hospital structures. The need to create specific databases and have a larger number of correlation studies, the importance of a multidisciplinary approach that may lead to a cooperation among disciplines, and the usage of a sociological approach in the definition of anamnesis. Application of narrative medicine as a key instrument for specific gender medicine, and thus for an adequate personalization of healthcare with the consequent improvement in the offer of health services. Diversification of tests and medical exams at national level, the drafting of specific protocols and, if possible, of gender-oriented checklists. The challenges emerge from the analysis. The first one is concerned with the formation and training of doctors and health system operators. In this regard, further coordinated multidisciplinary actions would allow a wider usage of the new approach both at theoretical level and in clinical practice. The second one is concerned with the ability to conduct innovative research and data mining, which may allow the improvement of protocols and eventually more adequate health care. The third one emerges above all from the mapping of international experience and is concerned with awareness and people involving activities aimed at further favoring prevention and the promotion of health care, also through a gender-sensitive communication. Finally, the fourth challenge is the necessity to favor the creation of exchange and better internationalization. Some anticipation of guidelines and suggestions of possible interventions which are being arranged in a dedicated toolkit. First, an international approach among the different areas of medicine and human sciences, which take into account differences deriving from gender to guarantee the property of research, prevention, diagnosis, and care. Promotion and support of research, biomedical, pharmacological, and psychosocial based on gender differences. 3. Promotion and support of the teaching of gender medicine, ensuring adequate levels of training and updating for medical and health personnel. Promotion and support of public information on health and disease management from a gender-different perspective. Creation in the academic context of an institutional officer delegated for gender medicine who, in coordination with courses of studies presidents, will take care of defining strategic plans for inserting specific modules of formation and training. Strengthening of the role of cooks, consolidated committees of guarantee, they carry out an important zip function by providing space and structure within which it is possible to project, formalize, and give publicity to initiatives of gender medicine in accordance with an implementation of codified activities and with the officer delegated for gender medicine. We organized some events. The first event on the 14th of September is a seminar focused on the impact of COVID-19 on old age population, and the subject matter will be analyzed from a gender perspective. This seminar is organized along with other 5 Italian universities, University of Catanzaro, University of Bari, of Macerata, and of Salerno. It will also be the occasion to discuss the guidelines that our work unit has been elaborating in its toolkit on gender and medicine. The second event, on 17th of September, will see the participation of the rector of the University of Pisa, the head of the Coordination Center for Health and Gender Medicine, the director of the Department of Clinical and Experimental Medicine, and the Consolidated Committee of Guarantee of the University of Pisa. And this occasion, it will also take place a debate on the gender approach medicine and the naming ceremony of the city promenade of Aulla to the first graduate medicine in 1893 at the University of Pisa, Maria Fischerman. Thank you.
Thank you for the work done, which might seem not of easy access to all, but still is of great importance and worth surely further research in it.